Why can't dentists provide a normal service during the pandemic?
The reason for dentists not being able to provide a normal service during this pandemic is really to reduce the risk of transmission from an infected patient to dentists and their dental staff. Several dental procedures have got a high risk associated with them. For example, the production of aerosols, that's the use of drills with water sprays produce a mist or an aerosol that can increase the risk of viral spread from an infected patient to the dentist and their staff.
If dentists have personal protective equipment, can they carry out these procedures?
The supply of PPE, as we've all heard on the news and various media, is restricted significantly. It's basically hard to get PPE, and the urgent dental care centres have been able to source sufficient quantities of PPE. This PPE is required for the protection of the dental staff and dentists and their dental nurses. And as I say, this PPE is not yet available to dentists in their own practices.
What can my dentist do for me if I'm in pain?
In the first instance, dentists may give advice. They may examine the patient and treat the patient. They may offer analgesics such as painkillers, antibiotics, or simply advice, as I say, or they may examine the patient and provide some simple forms of treatment, treatment that doesn't involve an aerosol, therefore doesn't involve a drill, doesn't involve the mist associated with the drill. These types of treatment can be provided, such as simple extractions, or the dentist may refer the patient under certain conditions to one of the urgent dental care clinics that have been set up across Northern Ireland.
I've heard you can only get extractions, not fillings or root canal treatment at these urgent dental care centres.
The role of the urgent dental care clinics set up across Northern Ireland are to address the following issues. Firstly, severe pain, bleeding, infection, trauma or swelling. Extraction or root canal treatment may be provided, but the extraction will control pain, infection and swelling more predictably than root canal treatment. In other words, if you have a tooth extracted, you remove the source of the problem. The area will take some time to heal, as it would do after any minor surgical procedure, but will heal up fairly predictably. Whereas with root canal treatment, especially if the tooth is infected, the tooth may not settle down. There may be residual infection retained within the tooth, which could cause additional pain, discomfort, and increased swelling. For example, abscess formation, which can, in some instances, be quite serious and difficult to resolve.
I don't want to have an extraction, but I'm in pain. What are my options?
Such treatments may include analgesics, antibiotics, or simply advice to patients. The fact that a simple dental extraction does not involve a drill and therefore no aerosol, this procedure carries very little risk of transmission of the virus. Therefore, simple extractions can be carried out in the general dental practice. These do not require significant levels of PPE. Normal goggles and face masks, the normal PPE that a dentist will wear during a normal time will suffice, and dentists obviously have access to this simpler form of PPE.